Thank you. I guess we're talking to friends. That's the challenge with awkwardly scheduled press meetings that compete with other things that are going on. I do want to thank you for being here, and I want the opportunity to be one that celebrates interventions and solutions that are bottom up, and really today's press conference is all about that. My name is George Ayala. I'm the Executive Director of Impact Global Action for Gay Men's Health and Rights. This press conference is intended to draw attention to community-led innovations and solutions to the sexual health and rights needs of young gay and bisexual men. We're going to do that by both celebrating the winners of a global challenge that we issued earlier this year, calling for proposals and solutions from around the world. Two of them were selected at our pre-meeting, which happened on Sunday of this week. The pre-meeting was youth-led and organized around 12 finalists in that global challenge. The winners are from Vietnam and Zimbabwe, so I'm very, very excited to have representatives from those organizations speaking today. We also want to highlight the release of a new technical brief that is called Out With It, HIV and Other Sexual Health Considerations for Young Men Who Have Sex with Men. This brief is important because it's a brief that was done in collaboration with the WHO, UNFPA, and UNDP. And it puts forward some really important evidence-based information about sexual health and HIV, and lays out some solutions for folks who are doing work at country level. So with that, I'm gonna just kind of immediately pass it to our speakers, and I'm gonna move from my left all the way to the end, and I'll ask each of the speakers to take 5 or 10 minutes to talk with you, and I'll also ask them to introduce themselves. Start us off.
Yeah, welcome. My name is Shadrach Elinasho, but my preferred name is Nisma. I am a trans woman, and I work with trans and intersex rights in Zimbabwe. I am the admin documentation officer. Thank you.
Hi everybody, my name is Tung from Vietnam. I'm working for Lighthouse, an organization working with MSM and transgender people in Vietnam to improve sexual health and rights of LGBT and MSM and transgender people in Vietnam.
Great, thank you.
My name is Gilles Mokafane. I am a friend of Impact. I worked there for some years. I'm an activist and a researcher from South Africa, currently at Harvard University, and I'm a member of the IAS Governing Council.
Hello everybody, I'm Sergio Lopez. I am also an activist in Paraguay with a group called Somos Gay. I'm also a proud member of the steering committee of Impact, and I'm glad to be here as well with the two winners of our global contest and the challenge.
Great. So I'm going to give each of you an opportunity to make a statement, and Sergio, you want to get us started?
Sure. Well, we are here, I think, that mainly to celebrate this victory, but also to reflect on the past couple of days that we've been having some interesting discussions among not only the young people who are represented in the Global Village, but at the AIDS conference as well. And also, I think that we had a chance to revisit some of the past victories I think that we had in the last years, but also to think about the challenges for the next period. And in doing so, we are pretty much proud of the work and inspired by the work that not only these two representatives of the global contest that we had as Impact, but also of all the young people who contributed to these very innovative ideas and proposals for solutions. I think that this really shows the commitment that the Impact group has with the young gay people's need, and also a lot of commitment to advancing a necessary discussion for us to reshape the model in which we are responding to the HIV epidemic globally, and in particular for young gay men and transgender women in all key populations. And I think that in saying that, I'm beyond proud to be part of this team, and also to use this opportunity, the AIDS 2018 conference, as a platform for us to continue rediscussing all of these issues, and with these two innovative solutions that we are super happy to also be a bit of part of, I think that we can definitely generate a momentum for us to continue the fight that we are advancing in many of our countries. So again, thanks for the opportunity, and I'm really glad to be here. And again, congratulations.
I'm going to attempt to contextualize this event in this moment in HIV response. As all of us know, or many of us should know, about half of new infections worldwide happen in key populations, and gay and bisexual men and sexual and transgender people with drugs, sex workers, very disproportionate to the burden. And I might have left out groups, and I apologize about that. The HIV epidemic follows the contours of inequality across the world. And so the most socially vulnerable people are also the people who are most affected by the epidemic. But it does not diminish human creativity, it does not diminish imagination, it does not diminish love, it does not diminish resilience. And this competition is in a sense a celebration of all those things, but more importantly, an investment. Youth leadership at Impact is being institutionalized. The youth are a very big group, a growing group demographically worldwide, and this is where the epidemic is going to be. And I think as we speak about the need for youth-led interventions, youth-led programming, it's important to ask people whether they're just paying lip service or whether they're actually institutionalizing that idea. And I think both this competition and the governance structure of Impact in general are testament to kind of that institutionalization, and it's important to track. These ideas and experiments that young people in marginalized communities embark on are hugely important, not just for those communities, but for the entire response. And I'll say why. I'm a commissioner at the IIS Lancet Commission on HIV epidemic, the HIV response and future global health, and we released a report last week, which we're discussing tomorrow evening on Thursday. And in the center of this report is the idea of the HIV response as a silo being infeasible. And where folks are kind of at is the idea that HIV should integrate broader health concerns, broader health needs, and there can't be a solitary HIV response globally anymore, not for very much longer. And at the same time, the HIV response has led to all kinds of innovation across populations, across areas, across different communities. And the challenge of the moment is to have these big systems which serve everyone, but which serve everyone. Big systems which respond to the distinctive needs of all the people who need services, and all the people who need different kinds of services, not just HIV services. And this seems like an insurmountable task, but there's lots of programming that's happening which might give us clues as to what to do. So these experiments are not just important as conference, they're not important for key populations. They actually could be where we find new models for this thing that we're trying to embark on in the global health response. So to just close off my comments, I would urge anyone thinking about this paradox of health systems which serve everyone and health systems which serve everyone, to look to these programs, to look to programs of communities that are under siege, that have to respond under siege, that have to use their own resources, donor resources, public health facilities, and make something work in this really broken system, because that is maybe what we need to do to coordinate all the work that we're trying to do in the global health response going forward. Thank you.
Thanks, Galetto. Let's go to the winners of the global challenge. Do you want to start us off?
Thank you so much for inviting me to here today. I think young people are now in the center of HIV epidemic, not only in Vietnam, but I think in our region and in the world. Actually, our idea with HAN application to providing the sexual health information and services, and also the safe space for the young MSM and bisexual men to where they can find, they also can make friends with the other people. It's come from the community very soon in 2017, when we conduct a lot of focus group discussions, also assessment. But then we don't have any place or platform to share our ideas. So I really appreciate with its event, because that is really great opportunity for young people like us to share our idea and innovation. I feel that our voice can be heard from you guys. So I'm really appreciate that, and also really happy to be here today. And I will share more detail about innovation after.
Do you want to talk a little bit about your app?
Yeah. Actually, Hunt Art is we really want to build the application for our community to be a best friend for them, because now most of interventions approach, they're trying to do outreach and reach. So I think it's really passive way. So we trying to giving our community a tool and also a friend to help them manage their own health, to proactive in seeking the services and so information, and also to be like more like empower them to manage their life and to be better in the future. Basically, Hunter provide firstly the adequate information, not only on HIV, because HIV is only one issue that faced by my community, but there are mental health, mental issues, and the lifestyle, and a lot of like problems with MSM and bisexual men in Vietnam. So then the adequate information not only focus on sexual health or HIV, but also the other information that our community needs, like how they can happy with their sexual life, or how they can easy to protect themselves when they use drugs, harm reduction services, information on the rights. There's some law existing for MSM and bisexual men in Vietnam. We also cooperate with the Ministry of Health and CDC and some really professional to make sure that information is adequate, and also this is the right information for our community, because now on the internet they can easy to search on thousands of results, but half of them not the right information. So secondly, we also provide them the detailed information of services of the gay and bisexual men life in Vietnam. And it's not only some healthcare facility with detail, they can also booking online, they also can see the direction where they can come, also the services they can receive at the healthcare facility, and also like the cost and also the time close, time opens. It's very detailed. And also there are some entertainment place and some community friendly place like coffee shop, community event like pool party, or we have some like community workshop. They also can easily to find information on our apps. But our big question is how we can make the health apps more interesting for our community and attract them to download and use the apps. So we conduct an online assessment, and most of people respond that I really want to connect with the other people in my community safely. And then we think of untapped room where people can easily to find into any nickname, and then to connect with the other people in the community online. That also the way we can build relationship between an online app with the community, and make sure that it's become being a friend with our community.
Thank you very much. Can we go next?
Thank you. First of all, I would like to thank Impact for inviting me here. We hardly get a chance to get to speak for ourselves. Most of the times we are represented by people who are not experiencing the challenges that we are experiencing. So first of all, I'd like to thank you so much for inviting us here, and it has been a good space lately where we got to tell people about our challenges and also ways in which we feel they can be addressed. Thank you so much.
Great. Do you want to talk about the intervention that you propose as part of the global challenge?
Okay, sure. Well, our intervention, we discovered that trans women have been very vocal in getting out their issues, but then trans men were a bit of shying away. They didn't have that space where they could meet and sit and talk about their issues. So the main project is mainly about trans men. They get to meet, to sit and to talk about the various challenges they face, be it menstrual health, which is a topic that has hardly been talked about. We are getting them a space to meet and talk, and we are also looking into generating IEC materials. We discovered that most IEC materials were being generated in English, which was kind of hard for those in remote areas to access them and to read them. Most of them can't read and write. So we are looking into generating IEC materials in a variety of our local languages. And we are also looking into doing Braille for those living with disabilities. And we have also divided Zimbabwe into 6 regions. So the people are not coming to us, we are going to where the people are. And we are also doing social media posts. We have our website, we have a Facebook page. We are also going to have WhatsApp groups. Our hotline number is already on WhatsApp, so people can reach us out there if they do need someone to talk to. We are also going to do sensitizations. We found out that the sensitizations that have been done, they were mainly focusing on healthcare providers. They were not focusing on all the people we meet when we do get to go to the clinic. We are starting the sensitization from the cleaners. We also want the security to be sensitized as well, because coming from a politically hostile country like Zimbabwe, where anything outside cisgender is deemed as evil, we want to get to interact with the people, with the general public, so they get to see what a trans person looks like, and maybe afford them a chance to ask questions, which does provide them a better understanding of our issues. Thank you.
I appreciate that. Thank you very much, and my congratulations to the two of you. I think before we open to questions, I want to just underscore a couple of themes that ran through certainly the statements that were given by panelists, but also the 2 interventions that ended up winning our global challenge. One is the need to kind of protect and ensure platforms that elevate the voices of young, gay, and bisexual men, cisgender men, and trans men. And the other is to create safe spaces where our communities can safely get information, where our communities can get linked to services that they need, and where we can facilitate peer support and a sense of community. So I want to thank you for that. With that, I'll also kind of share just kind of a commentary that it's really unfortunate that at conferences like this, the attention and the limelight often gets shined or shared to the industry elite, including, you know, high-profile scientists and celebrities, and we often miss opportunities to learn about innovation and community-led solutions. And for as much rhetoric as there is about young people and where HIV is concentrated, we really lack specificity and a sense of urgency regarding young, gay, and bisexual men. So I want to just end with that and ask if there are any questions. JD, can you, yeah, thank you.
Thank you. It was good to hear about this great work. I just wanted to ask George if you'd like to kind of project into the future your comment about these kinds of gatherings. What do you think would be that situation if AIDS 2020 is allowed to proceed in the United States as far as participation? I'd like to hear from everyone in the panel. Would you be able to participate? Do you think your peers would be there? Would you have more of a voice, less of a voice, or what would that be like for the folks who entered this form of engagement with Impact?
Sure, and I think we could kind of open that up to the panel as well, and we do have an IAS Governing Council member on the panel, so we're lucky in that way. Impact as an organization does not support the IAS's decision to bring the conference to the Bay Area in the United States. We simply don't think it's the right time. The human rights situation in the United States is deteriorating by the moment. And frankly, it's never been a safe thing for sex workers or people who use drugs or trans people or LGBT human rights defenders to enter the United States. And so we can't support that. And more, the decision to me reflects the AIDS Inc.'s deafness to community issues and the requests that we've been making to IAS to be much more community oriented. We are planning in partnership and in coalition with other key population-led networks to produce an alternative event outside the United States in 2020. I'll just kind of end there and just ask others to comment.
My name is Gilles Mokofan. I'm an IAC Governing Council member-elect, so I haven't taken office yet. I share the concerns that folks have been voicing about access to the conference. And this question has not been put, I'm not on the council yet and it hasn't been put to the council, but I think when it's put to the council, if it's put to the council, there'll be very robust debate within the council. And it'll be very important for folks outside of the council to continue to communicate their concerns vociferously, but also to be able to have a dialogue with the council. I think that might help to move things forward.
Yeah, maybe just to reinforce again the crucial need for us to be really bold and brave and really innovative. I think that we are taking part in a great group of people here, and also for the future activities or events that happens for us to gather together. Of course, we all look forward for the best conditions to be there and the guarantees for our human rights to be defended and protected. And of course, this is no exception to the AIDS 2020 AIDS conference if it happens to be taking place in the US. So of course, that I think that as part of Impact Steering Committee, also we're very committed to these values, and again, just to reinforce the crucial need for our bolder response, and taking so much action in protecting not only the communities that are now quite unprotected, but of course to continue the fight and the dialogues that are very crucial for our movement.
And Glenn, I really appreciate your comments. I take it as an invitation, and believe it or not, we have not received an invitation from any of the current and standing IAS Governing Council members to participate in that discussion. We did get an invitation from Kevin Osborne, who's a newly appointed executive director for dialogue, and we'll take him up and you up on that invitation. Other questions? Yes.
Hi.
Hi. Can you step up to the mic?
Hi. I'm Mike Kavanaugh from an organization called HERO, and we're kind of for newly diagnosed people living with HIV. We do entertainment news and cover these kind of things. And I just want to make a comment. Congratulations to both of you for your very innovative solutions. And I think that what you're saying is really important. It's very overwhelming to be a press representative at this conference because there's just so much going on. And I think a lot that's overlooked is these great ideas. And this is something like you maybe bring up when you're on this committee, is that we need a platform where these great ideas are shared or available somewhere. Because a lot of the theme for me this conference has been the way we're integrating youth into solutions and finding ways to reach them in different groups. And it's kind of amazing to share these ideas, and I just don't see that happening. So I'm doing my best to get these ideas out there, but I think we need to do something that's very important.
So, I think that's very important. Part of my platform when I ran for council was to find ways to start tokenizing community voices and see community interventions as an important input in the social epidemiology of HIV. And but how that plays out is kind of made complicated by the structure of the IAS itself. So, like decisions about programming itself don't get made by the Governing Council, I think. There are other committees that are appointed to do that kind of work, and I think it will be important for all of us to keep an eye on those committees and to track whether they are doing the things that we want to see in the response, particularly making sure that there isn't a community conference and a scientific conference, but this kind of platform for exchange across.
I also think that there's quite a bit of condescension in the rhetoric currently in the HIV sector regarding youth and youth needs, and oftentimes it feels to me like young people are, as Kaletsa was suggesting, tokenized and talked to or talked at, and never brought into the conversation as equal partners in the creation of solutions or the presentation of those solutions. And in addition to that, we get kind of caught up in debates about hard to reach communities. And the fact is, and the reality is that we're not hard to reach. We know where we are and where to kind of reach out to each other. So that to me is really nonsense. And we have to challenge that kind of rhetoric because it doesn't get us anywhere.
I want to add because as I mentioned that there are no platform for the community to sharing our idea and also our voice. So I really hope we maybe have an annual platform, forums for the community to raise our idea, our innovation, our voice, and also to sharing and exchanging experience between the country and country, between the region and region, and then together we can do a lot of things, not like 2 hour innovation can win today, but I think 12 innovation and the other innovations of community should be invested and also appreciated to make it come true in the future. And I really hope in next conference or next forum for the community we can share our pilot result and our experience with it in the beginning. But I really hope that the impact can create more outreach, more platform and forum for the community in the future, where a safe space for people to speak out, to raising our voice in reality and also our idea.
Other questions? Don, I see you percolating there.
I guess I really wanted to ask a question each of the prize winners, and maybe they're fairly simple ones, but first to Tom, I'm just wondering if you could outline the scope or the scale of coverage that you expect your app to cover within Vietnam. And Ms. Miles, I think you without wanting to raise a divisive issue, I'm just wondering how trans men, or at least trans men in Zimbabwe, what their relations are like with gay men, and to what degree, what sorts of things would you like to see, or what sorts of would you like to see in engaged on an equal basis with gay men? I guess I'm really asking, do you feel that it's a difficult place to be with regard to some particular gay men at least? So Tom could go first while you have to think about it.
Okay, yeah. For your questions, I think for the Hunter app, we really want to bring the safe space for our community to learn about information services and also make friends with other people. And in our targets, we really want to reach around 3,000 of MSM, young MSM and bisexual men download and using the apps in the after 1 year the app launch. And for sure, in our plan, we also really engage the community into the develop the apps as well as to in the process of adapting and also developing the apps, because this idea from our community, the content of the app is also from our community. So that is the highest thing. We really want to change the mindset of the community. They have to more proactive. They have to empower for themselves to seeking and to protecting their health. Now most of the project is targets in like new case finding HIV, like PEPFAR or Global Fund. But I think our community need more than that. We need sexual well-being. We need more information than that. So that is what we really want to build with Hunter apps in the future. And with the name of the Hunter app, I also explained in the app with it because most of young people in Vietnam, especially young gay men and bisexual men, they want to be the hunter and they love the feeling to do hunting something like handsome guys, six-pack guys, or like hunt boyfriends, hunt hunt for the health. So then I really want to hunt will make them to be safe hunter and to be healthy and happy life.
So, in my country, trans men have been included in LGBT women's spaces, which they find very toxic. So, they face a lot of discrimination, especially from lesbian and bisexual women. They are just told, you're a woman, you are female, and yet they are male. Can you imagine someone telling you that you are this, you are not that? And especially in cases where a trans man comes out as gay, people will be like, you're a woman anyway, you love men, you know how it is. So I feel our idea will give them that platform so that they can speak out against that double stigma they face from the L's and the G's, and also from the general society.
Yes.
Myself from News Service. Could you feel free to speak about dialogue you may be having in your own countries with religious communities, and how, if they're supportive or repressive, or however you would describe that relationship?
Okay, we have had dialogues with religious leaders. We found out that we kind of still have a long way to go, because the few that attended our dialogues, they are not really accepting of us. They are sort of tolerating us, but when they go back to their churches, they are not spreading that message. They're just attending for the sake of that we invited them. I feel those faith healing sessions they hold, I find them really bad, because in Zimbabwe we have many gay men and trans people going to prophets and then later on giving testimonies that they have been healed from their gayness. I feel it's kind of misleading people to people who have never been in that situation. They could never understand. So I still feel we have a long way to go. We have a lot to do.